Hello, my name is Julie Verdier. Today, I will be presenting how to prevent and reduce the risk of surgical site infection. The definition of a surgical site infection is an infection that occurs after surgery in the part of the body where the surgery took place. Surgical site infection can sometimes be superficial infections involving the skin only. Other surgical site infections are more serious and can involve tissues under the skin, organs, or implanted material. Different levels of infection exist. There are superficial or deep infections which are managed differently. We must suspect an infection when we see these clinical signs. The patient in the video has recently had a reverse arthroplasty on the left shoulder. He is now stiff and complains of pain. A low-grade infection should always be considered, but might to be obvious. Contrary, in the picture on the right, there is an obvious infection. There is wound dehiscent with a fistula. If there is a suspected infection, these are useful lab tests and radiological signs. However, intraoperative samples are more reliable. You should try to take at least 5 samples of tissue, bone, and liquid in order to identify the germ. 90% of risk factor come from patient flora and 10% from the environment. The main germ identified in infection occurring after surgery is the Propionibacterium acnes. This is a gram-positive anaerobic bacillus and commensal germ of the skin from patient's flora. It is responsible of more than 50% of shoulder infections. It is a slow-growing germ responsible of low-grade infection. The laboratory often needs more than 21 days for culture growth. For instance, Dr. Tran found in a retrospective study of our surgical database of almost 9,000 patients involving nearly 5,000 shoulders that cultures were positive for P. acnes in 92 patients, approximately 2%. How can you prevent and reduce the risk of infection? Let's talk about preoperative prevention. Before the surgery, the skin of the patient must be prepared by removal of axillary hair. However, not by shaving because you can cause skin lesion. Also, dental hygiene is important to not increase the risk of postoperative infections. Finally, there is an American program, the National Nosocomial of Infection Surveillance Score, which is an estimation of patients' risk for surgical site infection. The results depend on 3 parameters: ASA score, Altemeyer score, and the time of surgery. The ASA score reflects the general state of the patient preoperatively, established by American Society of Anesthesiologists. This classification ranging from a healthy patient to a moribund patient. The Altemeyer score is the risk of surgical site infection and degree of wound contamination. There are 4 classes ranging from clean surgery with 1% to 2% risk of infection to dirty surgery with more than 30% risk of infection. Obviously, the time of surgery is also taken into account for the final score. This table shows the scoring for the National Nosocomial of Infection Surveillance Score based on the different parameters. This score ranges from 0 to 3. The score of 0 corresponds to an infection risk of 1.5% and the score of 3 corresponds to an infection risk near 30%. Here you have an example of patient skin preparation with hair removal at CHU Nice Pasteur 2. Now let's talk about perioperative prevention. We start with the surgical setup. The instrumentation tables must be under the laminar flow and the nurse must be dressed in a sterile gown while setting up. On this final setup, you can see the limit of the laminar flow bottom right. You can also see that the surgical team is dressed with sterile gowns. To prevent the risk of infection, it's important to manage the operating room. You must perform your checklist and you must ensure the hygiene of the room is maintained. You must take care in grading the sterile environment of the surgical site by scrubbing hands according to regulation, using a double pair of gloves and also limiting the number of visitors in the OR. The gloves must be changed after the draping and also at regular intervals. Just before incision, the antibiotic prophylaxis has to be given to the patient by the anesthetist in coordination with the surgeon. You must have 2 knife blades, one for the skin and one for the deeper layers, and you have to make sure that the wound is frequently irrigated. Finally, the wound closure and the final dressing must be sterile. In this, we use no-touch technique, which means we do not touch the final implants and screws. Additionally, instruments are rinsed between each use. Finally, let's talk about the post-operative prevention. This can be done with these measures: good hand hygiene, proper patient education in consultation with the surgeon, proper wound care and monitoring with nursing care. In summary, it's important to evaluate the patient for risk of infection before surgery. The team and patient should be practice good hygiene. Prophylactic antibiotics must be given at the correct time. And we should always maintain good practices. Thank you for your attention.